For our earliest ancestors, the human body was a terrifying, sealed void. Illness and pain were not seen as internal failures, but as the work of invisible forces and spirits pressing in from the outside. To release these forces, prehistoric practitioners performed trepanation, cutting a hole directly into the skull of a living patient using flint or obsidian instruments. Archaeological evidence shows that these patients often survived the transgression. Skulls recovered with these openings frequently show bone healing around the edges, proving that humans were performing invasive operations thousands of years before the rise of scientific medicine. This was the beginning of a grueling, millennia-long quest to conquer the physical barriers of survival. To master the mortal vessel, humanity had to find a way to pierce the veils of anatomy, bleeding, and pain. Early Egyptian healers were masters of the surface. According to the Ebers Papyrus, surgeons specialized in treating what they could see: wounds, fractures, and excision of cysts. While they performed cauterization and circumcisions, they didn't routinely open the abdomen. The internal body remained a mystery. In Mesopotamia, the stakes of surgery were dictated by law. The Code of Hammurabi established a system of professional liability. A surgeon who successfully saved a patient's eye with a bronze lancet was paid well, but if the operation resulted in the loss of that eye or death of the patient, the surgeon's own hand could be cut off. These practitioners were hampered by strict taboos against human dissection. In ancient China, surgeons like Hua Tuo were forced to operate without an internal map. In one instance, Tuo reportedly had to cut into a warlord's arm and scrape a poisoned wound all the way down to the bone while the patient was awake and fully conscious. Without a way to see inside, even the most skilled ancient healers were trapped on the outside of the vessel, guessing at the structures hidden beneath the skin. In ancient India, surgical training became a practical science. The Sushruta Samhita detailed 121 different steel instruments, and students practiced their craft on objects, lancing leather bags and making incisions in pickles before operating on patients. This technical foundation allowed them to rotate forehead tissue to reconstruct a human nose. A massive shift occurred in Alexandria, where systematic human dissection was finally permitted. Physicians like Herophilus and Erasistratus isolated and mapped the hidden architecture of the heart, the nerves, and the blood vessels. This anatomical mapping led to the discovery of blood vessel ligation. By physically tying off vessels to control hemorrhage, surgeons could finally perform operations that were previously fatal. Amputations, hernia repairs, and the removal of bladder stones became feasible once the bleeding could be stopped. Roman surgeons refined these techniques, utilizing a massive inventory of specialized tools. Aulus Cornelius Celsus described the use of vascular clamping and sophisticated plastic surgery, utilizing bronze forceps found at sites like Pompeii to manage complex wounds. When dissection was later restricted, Galen used the traumatic wounds of gladiators as a substitute. These open injuries allowed him to observe the internal body in real time, helping him map the nervous system and determine how spinal cord injuries affected specific bodily functions. By charting the internal organs and proving that fatal hemorrhages could be physically clamped, ancient healers transformed surgery into an applied physical science. They had successfully moved past spiritual guesswork to address the body as a mechanical structure. After the fall of Rome, this progress stalled in the West. Medieval church restrictions, such as those from the Fourth Lateran Council in 1215, eventually barred the educated clergy from performing surgical incisions or using cautery. Surgery was separated from academic medicine and handed to a separate class of craftsmen, the barber surgeons. Trained through apprenticeships and guilds rather than universities, these practitioners managed fractures, bloodletting, and minor procedures as a manual trade. While anatomy and bleeding were being addressed, the veil of pain remained a terrifying obstacle. Healers used soporific sponges impregnated with opium and mandrake to dull the agony, but these primitive anesthetics were so unreliable that patients often had to be physically restrained during the procedure. Because pain was so difficult to manage, major internal surgery remained a horrific last resort, reserved only for life-threatening conditions or the most extreme cases of bladder stones and tooth decay. During this era, Islamic scholars preserved the ancient surgical maps. They translated Greek and Roman texts, ensuring that the hard-won knowledge of the past was not lost to the collapse of the Western institutions. The surgeon Al-Bucasis produced Al-Tasrif, the first illustrated book of surgery. His detailed drawings of scrapers, saws, and forceps kept vital operative techniques alive, serving as a bridge between ancient practice and the later revival of European medicine. This protected knowledge eventually flowed back into Europe through centers like the medical school at Salerno. Surgery began its transformation back into a rigorous, written discipline, reconnecting with the anatomical studies of the past. By daring to open the body, humanity had finally mapped its architecture, mastered the flow of blood, and made its first crude attempts to survive the pain. They had pierced 3 of the mortal veils, leaving only the invisible threat of infection for the modern age to solve.